welcome everybody. Philip Aldridge here from Hazan. Just wait for a few more people to join us, and then we'll be off. Right, we'll get underway. My name is Philip Aldridge. I'm the Executive Director of the Health and Safety Association New Zealand, Hazans. And today we've got a couple of talks combined into one. So we have a talk from Malcolm Staves and Bing Wing from L'Oreal about the impact of COVID and how they manage it around the global company L'Oreal. So that'll be a very interesting talk. And so welcome Ben and Malcolm. And then we'll also hear from Melissa about the 1% Safety Initiative and the 1% Safety Foundation. So without further ado, I'd like to pass you across to Malcolm to get underway.
Yeah, okay. Hi, everybody. Before I share my screen, I just hope that you and your families, wherever you are in the world, are safe and well during these unprecedented times. So I shall now share my screen so we can go into the presentation. Okay, so assuming you see everything now, it's good for you, Philip?
Yep, it's good.
Okay, so very quickly to introduce myself. So Malcolm Staves, I look after corporate health and safety and fire prevention for L'Oreal globally. And so that includes our operation sites through to our stores, through to our sales force. And I've been in L'Oreal now for about 12 years. And I'm joined by Bin Wang, who is our EHS and Security Director for Australia and New Zealand. Bin, do you just quickly want to introduce yourself very quickly?
Okay, good. Good morning, everyone. My name is Bin. I have been working for this company more than 8 years. Actually, I was transferred from China to Australia in 2017. So yeah, today I'm very happy with Malcolm to present L'Oreal health and safety.
Great. So what we're going to do, we're going to give you a little bit of an overview of what our systems are, how we approach health and safety generally, and then Bin will introduce to you our approach for COVID, both at a global level and a little bit more local that's relevant to you. And then we'll have a little bit of a chat about the future of occupational health and safety as we see it within L'Oreal, and then we'll sort of finish. So with that, Bin, I'm going to hand over to you for the first slide.
Okay, thank you, Malcolm. I believe most of you are familiar with our brands. You can see from pharmacy, supermarket, and our stores, especially for ladies. We have a more than 40 brands in L'Oreal Group, coming from all the cultural origins, Europeans, Americans, Japanese, Chinese, and Korean. The brands in red circle are the top popular brands in Australia and New Zealand. They are also the top contributors to fuel our growth. It's surprising that regardless of COVID-19 last year, we eventually increased by more than 4% in revenue in Australia. For New Zealand, I don't have the figure in revenue, but the units we send out to our clients increased by almost 9%. It's a fantastic. Next slide, Malcolm. We have more than 90,000 employees, including those in manufacturing sites, distribution centers, research centers, head office, and numerous store and boutiques. In ANZ, we have 3 country-level distribution centers, 2 headquarter offices, and 6 training centers, and 12 L'Oreal operating boutique and stores. Our sites are located in all the continents, crossing more than 150 countries. The real challenge to us is how to unite 90,000 employees into one mission and one vision, health safety all over the world, and respect to their local culture as well. And this is what Malcolm will talk about. Over to you, Malcolm.
Okay, thank you. So just want to give you a bit of an overview of how we approach on a global scale health, safety, fire prevention, and actually well-being. So as like with a lot of groups like our own multinationals, we have a single approach of one mission, one group, one vision approach. And basically that's because for the types of activities like been described, R&I, the stores, manufacturing, distribution centers, the cultures are different. The cultures are different, but at the end of the day, we are all one part of the L'Oréal family. Therefore, our approach is very singular in saying, okay, we have one mission, we have one vision, because we are one group, and that is L'Oréal. Within our organization, and this is something we've recently published, but we have a single 2025 objective when it comes to health and safety, and it's based on total incident rate, including employees and including temporary workers. And these figures here that you see are per million hours. So if you use, for example, per 200,000, you need to divide this by 5 in order to get what the equivalent is if you use 200,000. So at global level, we just set that 5-year objective. And the idea is that that is a target for the sites, the zones that we have globally to get to. What we then do on an annual basis is identify for each zone with them what we think are the priorities of focus areas. So it could be ergonomics, it could be process safety, it could be just general risk assessment, it could be fire, depending on the individual requirements, and they then are cascaded through to the sites. What this allows us to do is to tailor the programs at each individual site to what their requirements are, depending on where they are in their culture journey and what their performance is and what their needs are. Historically, if I went back 10 years, L'Oréal was very top down. So we would virtually say, this is the ergonomics objective, this is the hazard reporting objective, this is the risk assessment objective, etc. And that would come down on all the sites globally. That's no longer the case, and we believe that, you know, the leading indicators should be adapted to the requirements of the individual sites, and that should be done locally because they know their culture and where they're going better than we do really at corporate level. When it comes to the high-level strategy, we have 6 areas of main focus. The one is leadership. I think it's obvious, it's visible leadership. So at the moment, we're still in the process of trying to get our line management very, very visible at all levels in the way they have conversations and talk to people about health and safety. But our ultimate goal is that everybody can be a leader. Quite simply, you know, you can have people that are operators, people that work in our stores, that are actually leaders somewhere, whether it be at home, local community, on the soccer pitch, on the football pitch, playing baseball, etc. And we want to find that in them. So we have a long-time vision that we want everybody to be a leader in safety, and we have programs in place that address that. Risk management is fairly classical, as you all know, but we do have one program which is the equivalent of a SIF program, a serious injury and fatality program. We call it LIFE. We chose the acronym LIFE. It stands for life-changing incident or fatality event, purely because across all countries in the world, life is life. And everybody knows that behind the requirements in our LIFE program, there are people's lives. And if we don't do what we need them to do in this area, then we can kill somebody in L'Oréal, which is totally not unacceptable. And this is a top-down program. When it comes to people dying, when it comes to fatalities and serious accidents, it's not open to discussion. It's not open to people deciding what is the best thing to do. Like, you know, if you didn't have any speed limits on the motorway, we know people, if we don't get this right, could have a serious accident. Therefore, we put it under control. And that's a very top-down approach. And then we have a lot of other systems that are not top-down and that are organically driven locally. But this one, when it comes to people and their lives, it's very, very much top-down. We're at the moment, Health and Safety 4.0. We're like a lot of companies, we're looking at digitalization, new technology. However, one of the things that we've decided is that it's not digitalization or new technology for the sake of. It's new technology and digitalization because it makes sense. It makes sense to the line management, it makes sense to the employees, it makes sense to our people, with a single objective that we put something in place that saves time. It saves time for somebody within the organization so that people like the line management or the EHS professionals can spend more time on the shop floor. And for this, we have a global work group across all zones working on it, coordinated by somebody in my team to identify what those tools are and then decide how we're going to deploy and how we're going to do that. Health and well-being focus. This is, I think, a weakness very often of occupational health and safety programs. We're very much focused on the safety. We have a lot of indicators on the safety. When it comes to health and well-being, the focus is a little bit less. It's not at the same kind of level. And we're no different. I mean, we've got a very good ergonomics program, but when it comes to other aspects, I actually think we're averagey, and well-being is something now that my team at corporate level have taken on board. It used to be within HR, but they never really did a great deal with it. But now with us, we're driving this, or we will be driving well-being from the top down, globally, giving sites ideas of the kind of things they can do and helping them. Simplification or decluttering, we've been working on this now for about 8 years. And basically it's difficult to simplify in the sense that it's difficult to take away rules and directives. It's easy to say that, yes, we should do, but to take them away and then behind it, expect the sites to manage those kind of risks that were in your directives before, it needs culture change, and it's not something you can do overnight. So we've been working on this for a number of years to try and simplify our approach, simplify the messages, and give the reason as to why safety matters to me. And it's something I'll tag on and talk about a little bit later. Then we have our program Safe at Work, Safe at Home, which basically is all about driving our culture, driving what we know, etc., outside of work into the homes, into the local communities, and into other companies. And that's something that we're very proud of, and it's a great program and it's working very well. But the end game of that is when you're on a plateau and you can't drive your performance any further and you're plateaued out, you really need to change the way the people that they think about safety. And our Safe at Work, Safe at Home program does that because it gives them the reason as to why safety is important. And safety is not important. Well, it's not important that they work safely for L'Oreal, because if they do that, they're working safely for the wrong reasons. Of course, we all want them to work safely for L'Oreal, don't get me wrong. But the real reason people should want to work safely, not subject themselves to things that could give them health issues, etc., is so they can spend time with the family. It comes back to the leadership thing again. And if you can get people to realize that they need to work safely for the family, for the loved ones, etc., then we have a real process of creating safety. So very, very quickly, our overall approach is the strategic frame, is risk management, excellence, and beyond, which we apply to every single one of our programs. But within these, we have major programs that I'm going to say represent the subject. So life is one that I've mentioned already to you, and that's the epitome of risk management. The one thing we don't want is we don't want a fatality. So this is our main program within the risk management aspects. There are other aspects of risk management as well, but at the end of the day, first aid cases, minor lost time accidents, I would rather have those than a single fatality, and I'm sure anybody else would. Ergonomic attitude is our ergonomic program driving towards excellence, whereby we make ergonomics the priority, ergonomic workstations, designed by ergonomics by design, etc. And that's driven by a whole load of champions that we have across the world. In most sites worldwide have an ergonomic champion that we help them centralize, we network with them, we give them information, we feed them. Then we have 8 main pillars, and we've discussed many of them before. The one that we haven't really discussed, which is really important, is employee engagement. All our programs, when we design them as mini systems. We ask ourselves the question for each program: what is the role of the management? What is the role of the employees? How do we get visible leadership? How do we get employee involvement? And what do we need to check to make sure that from a KPI leading indicator point of view, what is going to make it successfully? And then we have the idea of the right tool at the right time. historically in the past, we used to put in a lot of programs and everybody used to try the best to put the programs in place because it came from corporate. The problem was some of them weren't sustainable. And the reason they weren't sustainable is because the site culture was not ready for the tool. So we learned. And what we've now done is we have an approach which is the right tool at the right time. We use a hybrid of the DuPont-Bradley curve, which we call our health and safety culture curve. It's not exactly the same as the DuPont, so we've modified it to our needs. And the idea is, depending on where you are on that journey towards an interdependent culture, depends on the kind of tools you are ready to put in place and the tools that will remain and be sustainable, okay? And it goes from the right-hand side, for example, and I think it might be on the next slide. From the right-hand side, very much reactive mode, very much into risk management. We then go through a program called Measure, which is like a behavioral-based safety program, except for it is very much top-down, okay? It's to align the management. It's all about line management on the shop floor, talking safety. Then we get through to the SIO program, and the SIO creates conversations between the line manager and his team and his operators. It's a hazard reporting system, but if somebody in my team reports a hazard, then I, as the manager, have to solve that through to completion. I project manage that SIO until it's completed. I may bring people in from engineering, I may bring people in from EHS. So you can see, depending on where you are on the culture journey towards interdependence, as we call it, will depend on exactly what kind of tools you're ready to deploy. Okay. We've mentioned about the health and safety next generation tools. I won't mention much more about that. It's a global program, and it's all about identifying the right tool for sites to create and free up people's time so they can spend time on the shop floor. What I want to do now is our program of Safe at Work, Safe at Home is all about trying to create safety, by saying to people why safety matters. So I'm just going to play you this film now.
We care because we can make a difference.
We take care of all employees' safety.
Thank you again, and we are really grateful.
We are loyal.
We're absolutely delighted to have been awarded the Rosper Gold Award.
It makes me really proud when I see the commitment that the DC team give on a daily basis to health and safety.
It's with absolute pride that I accept this award on behalf of Team Berry.
Together, we care.
We are very happy and proud to see that having safety as a core value is recognized by this prestigious ROSPA award.
At L'Oréal, we consider that you can't be number one in the field of beauty without being number one in the field of health and safety.
Congratulations.
Sono molto orgoglioso del nostro
nossos times no Brasil por sermos a primeira empresa da América Latina a conquistar esse importante prêmio.
La seguridad de nuestros trabajadores es uno de los principales valores de L'Oréal Argentina.
La belleza de nuestro éxito en seguridad se debe a que hemos logrado que el comportamiento seguro esté en la cultura de nuestros colaboradores.
In the plan, we are very proud of the safety culture we have.
Estamos convencidos de que la palabra seguridad no solamente es eso, una palabra.
The gold, the silver, the bronze awards are a thank you to those of you who have given us the gift of working lives lived safely.
A huge congratulations to all awarded teams around the world. Your incredible commitment, leadership and perfect execution when it comes to safety reflect, as so rightly said by Lord Jordan, that you are not only process-driven, but also, and more importantly, people-driven. I want to express not only my pride to see L'Oréal entities rewarded by ROSPA, but also my deep gratitude, you all, to have managed health and safety the way you did in this so turbulent moment.
Okay, so very, very quickly. So one of the ways that we try to create safety is by celebrating safety. Rather than having a negative viewpoint, we try to celebrate. And one of the ways that we're doing it is through our community work that we're doing with our Saving Children Under 5 program that was launched in China and in Brazil prior to COVID. And also actually celebrating by the sites getting recognized. When we actually had those virtual awards that were done with ROSPA, we had 2,000 people connected, including operators, including people in our stores, etc. So it was a great moment. So, Bin, to you.
Thank you, Malcolm. When everyone talked about 2020 was a very challenging and unique year, we saw the pandemic make us more stronger, more united than ever, which was a surprise to us as well. Soon after the coronavirus was identified as a global pandemic, L'Oréal Group released a pack of COVID directions we call the Safe Together. Next, please. Okay, these are not simply top-down instructions, but our position and the best practice to fight against the virus and the support to our business. Even given the difference of local regulation requirements, health advice, managers' duty of care, and the different COVID status in the countries where we have L'Oréal people. Next, please. If we close look at those instructions, they are more like country-level crisis management direction rather than health safety requirement documents. They are very straightforward and easily understood on non-negotiables and some flexibilities covering health and safety, security, HR, and crisis management. For implementation, of course, we must adapt local regulatory regulations at the first place. Next. In the pack of COVID instructions, there are two groups of documents to fit in the country where we have a different COVID context. Lockdown, or what we call the confinement documents, and exit lockdown, what we call the deconfinement documents. So there's a whole bunch of the documents you can refer to deploy in your function teams. Next, please. Okay. During the pandemic, our health safety professionals become a central point guiding the team to the right direction and prevent and minimize the risk to our business. Take a L'Oréal ANZ as example. We experience 3 stages: respond, react, and explore. Respond, since early March 2020, we entirely shift our priorities to COVID. We secured COVID supplies like PPE, masks, gloves, sanitizers, and even wipes from the market as much as possible. We update our business continuity plan and the ERP based on our context and situation for warehouse, head office, and the supply chain. And this is in reality is testing to our existing systems, React. And after the group COVID instruction were released, we, EHS, become a member of the country core team for crisis management. We are the key interpreters of all these documents. To better deploy these instructions, I transfer those requirements into 5 working level checklists for our teams and the sites, covering office, training centers, stores, and sales force, and also our warehouse. This is to help me cascade the requirements to ground level and dedicated to line manager to take their own responsibility with their duty of care. Explore. So this is the last step we call it explore, and we explored new ways to adapt COVID norms for maybe for a long term. For example, home become a part of our workplaces, and we provide ergonomics tips for them to how to set up the home station properly. Safe Together, Safe We Care program reflects the spirit of safe at home, safe at work. And Bionic is one of fantastic example we launched in our New Zealand warehouse. So Bionic stands for believe it or not, I care. Mental health first aider program is what we extend from physical health and safety to well-being, taking care of the people who are in need from mental health perspective. Next, Malcolm. So globally, L'Oréal Group implement a solidarity program to contribute the fight against the COVID. Thousands of tons of sanitizers, hand gel, skincare products are made from our factory and are donated to hospital, pharmacy, frontline health workers, as well as to our suppliers to support their operations. In addition, L'Oréal Foundation also donate more than 1 million euros and PPE materials to its non-profit partner to combat insecurity. Next, Malcolm. At the country level, like Australia, we see the COVID impact as accelerator to speed up the change we want to be part of in terms of the social responsibilities and digitalization and agility. We thank frontline health workers through our solidarity program called Acts of Kindness, and where we donate more than 300,000 products equivalent to 3 million Australian dollars at the retail price. Our HR is heading to more flexible working policy called remote working, allowing people to take 3 days a week for working remotely. As I mentioned at the beginning, we become more united than ever during the pandemic, thanks to Microsoft Teams. This tool is not only online meeting, but also like a real meeting room or office where we usually working together as one team. So even when we are returning back to the office in recent days, we still keep Microsoft Teams as a one option to set up a meeting. Over to you, Malcolm.
Okay, well, thank you, Ben, for that. I just want to, Philip asked me to put one slide in here about where we see the role of the health and safety, occupational health and safety professionals going. Traditionally, we're seen as experts, and very often we stay within our area of expertise, the domain of environmental health and safety. But the world is changing, and we have a different vision, which hopefully many of you will share. And we see the EHS, the environmental health and, the health and safety professional of the future being more recognized as a leader, more recognized as contributing to business value to the organization, but still keeping the level of expertise that we obviously need to keep, but also learning those business skills, understanding the business better, being able to have the vision of where we're going and able to drive towards that vision, being more strategic, being better at listening, being better at collaboration, and being better at coaches. We see this as, this is a tall order for the occupational health and safety professional, but from our point of view, it's critical when we look to the future of a world that's going to see more collaboration, more teamwork, more of the idea that, the problems of the future will be solved together, not alone. And I think within health and safety, within our sites, that, if we really want to get the safety culture that we want to get to, then we need to embark people. People need to understand the why it's important to them, but they also need to feel part of that culture and part of contributing to it. And the people that will make it happen is us, the occupational health and safety professionals. And therefore, that's why I think we need to move to more of a leadership approach in order to embark everybody. So that's basically it. Just one very quick take home, if there's any take homes. When it comes to overall systems, you need to focus on leading indicators, but I think you know that because it's the leading indicators that turn the system, that measure the efficiency of your system, and the output is the lagging indicators. Be aware of your role as a leader. COVID has given us a unique opportunity. Our profile has been raised within many organizations, and it's also time for you to be like us, the people in L'Oréal, to know and be aware of what our role is in the future of our organizations. The right tool at the right time, I'm sure you've heard that before, but honestly, trying to put something in place when the culture's not ready is like trying to put a square peg into a round hole. Visible leadership and employee engagement is absolutely key. You can't do without it, but no matter what people say in this world, make sure your foundations of risk management are solid. So with that, I'm going to stop this and just wanted to say thank you very much.
Thanks, Malcolm. So any questions you got? I think what we'll do is have some questions on your presentation, Malcolm, and then we'll go across to Melissa around the 1% Safer Foundation. Just a couple of questions from me to kick off. So if you've got any questions, please put them in the Q&A function at the bottom. What is the model that L'Oréal operates in terms of health and safety? Is it safety and health and safety separate? Is it a separate line function, or how does it work? Who do you report into? How does it work?
Okay. I report into operations, okay, yep. Even though I'm global. And it's historical, and that's because health and safety started very often in manufacturing, and it just stayed there within L'Oréal. But we operate a matrix organization, so I report into operations. We have people at zone level that report into operations, but they look after the entire zone, including Salesforce. And then we have people at the country level, like BIN, that report into the country. So it's a little bit different there as well. So yeah, it's quite atypical, and we're only health, safety, well-being. So environment is a totally separate function at corporate level, but it changes as we go down the organization. Like with BIN, he has environment and security as well.
And talk me, how do you engage line management? How does that work?
Always sometimes a challenge, but we have a particular program that I think you may have called, which I called a line management BBS. It's called Mesure. And basically it forces every single manager to get off their backsides, out of the office, onto the shop floor, having a safety conversation. And within that, and we're very top down in this. It's if you go to a site in Australia, New Zealand, or in Brazil, it's the same program, but adapted to local culture where needed. But the start of it is the same. You ask an open-ended question to, say, an operator. Okay, you always do it in pairs. You ask them, but the manager asks an open-ended question to the operator and then shuts up and listens. And then they work together. It identifies maybe a concern or something, and then work together to resolve that concern in the here and now. And then afterwards, maybe there's something a little bit more concrete to do. So we try and drive visible leadership like that. We have a safety training program and an executive college that everybody comes globally, whereby it's all about leadership. We link in safety. We teach them about heuristics. We teach them about stress management. We teach them about low-level signals and stuff like that. Leadership capability, qualities that we then link into health and safety. So it's not an easy thing because not everybody gets it. Because I'll be honest with you as well, people in operations get it. When you're talking to people that have worked for 30 years in a marketing function or a sales force function, the perception of safety is totally different, and you need to have a different approach for them. So there's no perfect answer, Philip, sorry.
Just add a little bit of comments to Malcolm. My experience for working Australia and New Zealand for last 3 years is that we need to find a proper working level tools for those line managers, especially like sales force, merchandisers, and those people are not in an operation environment, because you cannot simply just pass a document from our group that they ask them to follow. You have to transfer it into a proper like a checklist, and giving them tools. They prefer use the app in the mobile, and they prefer to do this in WhatsApp, something we have to adapt to their commercial world.
Yeah, I mean, just to let you know, Philip, before you ask me the next question, if you really want a good safety culture, the leaders have to find why safety is important. You can't tell them to be a visible leader. If they don't get it, they don't get it, and the employees will feel it. It's a long journey. Huh? We've been doing this now for 15 years.
Good point. There's a question from Mike Cosman. Hi, Mike. Do you have an independent audit and assurance function around critical risks and controls?
Am I okay to do that one, Vin?
Yeah, sure.
Yeah, yes, we do. We have a global, all our factories get audited externally on a 3-yearly basis. And all the rest of the sites, including admin, are on a 4-year basis. We have 572 sites that are either R&I, admin, operations globally. And it's an independent company, and the whole focus of those audits is based on risk. They get a culture audit at the same time, and the culture audit is done by L'Oreal EHS people, but the risk, and they look at all those those kind of things. And it's the only way sometimes to do it, to get the independent outlook.
Cool. One question for me is, historically, health and safety seems to focus more on safety rather than health, and obviously this COVID has exposed, mental health and everything. What is that driven out of the health and safety function, or how's it driven, and what are the focus areas?
You mean on mental health?
I mean, sort of health in general. We talked about ergonomics and everything else.
Ergonomics and everything that goes with it about adapting, the workplace to man is driven by the corporate team with a global program called Ergonomic Attitude that looks into psychological aspects of ergonomics, etc. And that we've had in place for about 10 years, but over the last 5 years, it's really matured. I mentioned the senior leadership program that includes, heuristics, which is why we do what we do. It's psychology, along with low-level signals. That's done for the line managers. All our the senior managers, all our line managers, we teach them about something called ABC analysis. I don't know if you're familiar with that, about how do you influence people? It's the antecedent, the behavior, and the consequence, and what is the best fit of that. So we teach them a very simple approach of that, which basically says that the best way to do safety is by positive recognition, the bottom line. So we, on top of that, sort of like we have training programs on like stress management, emotion, to try and get people emotionally fit, improve their emotional intelligence. That's been in place for about 4 about 4 or 5 years. So we've got a lot of different programs. The thing is about working in a matrix organization, Philip, is the fact that at the end of the day, everybody does their bit, if you know what I mean. HR have the little bit. I mean, we've got well-being completely now. So nutrition, vitality, exercise is all coming through health and safety because we deploy extremely well through our networks. HR has still got mental health, okay? And we do a number of things on that. But again, they're now doing it in collaboration with environmental health and safety because it has to be right. The thing is about mental health, just to let you know, it's new to the profession and we need to be careful not to try and be psychologists and psychiatrists. So we need to know what the limits of our profession are. And at the moment, we're very conscious of the fact that we could help people identify low-level signals, but after that, you need expertise. And that's not our expertise at the moment.
Cool. I've got time for one more question and we'll pass across to Melissa. Another one from Mike. With a one team approach, do you still apply standards at a country level or use higher standards globally? For example, WES.
What's that WES?
I'm not quite sure what it means. Mike, you want to?
Okay, it doesn't matter, but I can answer the question anyhow. We have a hybrid. So obviously the minimum requirements are always country requirements. After that, we have a group of standards directed at global level.
Yeah, thanks, Mike. Workplace exposure standards. I should have known that.
Okay, yeah. See, I would if it had said OES, I'd have known occupational exposure standards. But yeah, so occupational exposure standards at this moment, as an example, we use local requirements. Okay, whatever the local is, but that's going to change in the future. We're currently looking to go to either the UK or the US NIOSH, and we'll apply them as minimum worldwide. But as another example, we apply NFPA, the fire prevention standards, globally. So it doesn't matter whether you're in China, Korea, Australia, the minimum standard is NFPA for the group. Okay, so we have things like that. We have a safety validation program, which is based on EU certification, but it's internal to L'Oreal. So we validate every single piece of equipment, and it's either validated green, orange, or red. Red, you can't use it, right? And that's global, taken from the European standards. And apart from that, we have quite a few standards, whether it's from systems and, like you saw, Mesure, SIOs, or whether it's due to ammonia, hydrogen peroxide, process safety, whatever. So we have standards as well at global level, and they go down. If I can add one more thing, typically our zones and our sites don't have additional standards beyond what is corporate, because if we have a thing that's relevant in China or to a warehouse in Australia, and it's a good thing to do, we apply it worldwide. And the way we do that is by making it a corporate standard.
Cool. Thanks for that. So we'll probably now switch to Melissa. Hi, Melissa. So been quiet so far. So and just switch the topic to 1% safer and 1% Safer Foundation. So over to you, Melissa. Perhaps you want to introduce yourself first, and then we'll kick off.
Great, thanks. Are you hearing me? Are you hearing me, Philip?
Sorry, yes, I am. Yes, yep.
Okay, great. Good. Well, thanks very much, Philip, for the opportunity to join this session and to talk about initiative and really exciting movement that's gaining momentum, and Malcolm is also part of it. So just really happy to be able to share this. And I think this opportunity ties in really well with 1% Safer. And for me personally, I'm a deep believer of collaboration, learning from each other, best practices, and Malcolm just touched on it in terms of if something is seen as a good practice in one part of his business, it's translated across. So I think that's really good. It's good. So what is 1% Safer? So before I get into what it is, it's why it's there. So many of you all may know about the ILO statistics about globally the workplace fatalities and illnesses, that as a result of illnesses, and about 2.78 million people die on average each year. So if you think about it, that's 7,600 people every day. I think that's really a why 1% Safer has come about, because it boggles me, and it's one of the reasons why I'm into health and safety. When I saw these statistics, so how could we help make a difference to that 2.7 million lives a year? So the how. So this started off with a book that's the brainchild of Dr. Andrew Sharman, who was the Irish president up to last year, but also has written several other books. One of his books is From Accidents to Zero. And I think last year, as he shared the story, because, at the start of COVID, he was in lockdown, and he started to think about, what can I do to continue to make a difference, with these statistics we're seeing and the economic impact that we knew that was going to happen as a result of COVID. So he gathered 142 authors to contribute to this book. And you see the names here, and a lot of these people are known across the world for health and safety leadership. They are practitioners, institutional leaders, people like Todd Conklin. They've been talking about health, safety, continuous improvement. So it's really amazing that he got this group of people together and challenged them to write one page in this book. And I've read through the book, and it's so insightful because it spans so many different topics, from risk management due to COVID, business continuity, safety leadership, or leadership as Malcolm talks about, mental health and well-being, which is such another important topic, and we're seeing more and more of it now coming out of the impacts of COVID. So it started off as this book, but it has become so much more. In that, one of the—
Just one point there, Melissa, there's a couple of New Zealanders. There's Francis Barton, and there's Mike Cosman as well, so I've picked it up.
Oh, okay, great. Yeah, so and that's the other thing, there's global representation of contributors to the book. So it makes for really insightful reading. There's a span of topics. So even if you just wanted to get the book from that and take the nuggets of best practices, that's a value from it. As I said, it's more than the book now, and it gets into beyond the book and making that difference. And the movement of the 1% Safer has now focused on taking the funds from the book to help OSH professionals as well as the community. So when now looking at the charitable aspects of making that continual difference. So we've set up a foundation, not for profit, where all of the proceeds from the sales of the book is going into helping OSH professionals who may have been impacted due to COVID, or wants to progress their professional development, or even as seed capital for community activities. So with that process in place, we now have a foundation. So you'll see two common faces there, and a couple of other people. So we have a foundation representing myself, Malcolm, Andrew, Tamara, and some other contributors who are giving up of our time. So we're volunteering to this foundation to help put structure into the foundation and the activities. So that's one of the ways that we're wanting to make a difference. Additionally, there's the opportunity for persons to join the movement. So we've gone live via the 1% website, and there is the opportunity for you to make pledges on how you would make the world 1% safer, sharing ideas. And going beyond that is setting up a community where people can share best practices and learn from each other. Again, that spirit of collaboration and continual improvement to make that difference. And I know people may think 1% is that enough. The thinking is that if we make 1% difference every day, that, incrementally, it makes a huge difference. And even 1% will reduce the number of fatalities in a year by 27,000, which, 27,000 families would not have to bury a loved one, and all of the consequences of having a workplace illness or death in a family. So we have the movement where there's an opportunity for you to join. And I just posted here some of the statements that a few people have pledged on the website. So for example, Devlin, I'll continue to try and have authentic conversations, particularly focusing on mental health and well-being. I've challenged myself to ask 3 people, how are you today, every day, and to listen to the answer. And then, so we have some others here. And one of the other things about the 1% Safer, it's global. Again, the contributors to the book have been across the globe, and the participants in the movement have been global so far. So again, we can really learn best practices in different places and take it back to our site. So the other thing in terms of moving forward with the movement and the foundation is we're setting up a conference, a virtual conference. It will be one of many future conferences, again, with the opportunity for us to get together, collaborate, and share. And this first one will be April 28th of this year. And so you can access the information via the 1%safer.com website. And again, we're looking at speakers who are contributors to the book, and as well as people who've made pledges, again, to share, collaborate, grow, and learn from each other, make that difference back in the workplace. So the mission is to make the world a safer place, support the health and safety profession, and where everyone can make a difference. So I know I ran through that pretty quickly, and I think, Philip, you have a copy of the book. I don't know if you wanted to just to show it on the screen.
Yeah, let's get it for me. Hang on a sec.
So I can't come back onto Zoom. Good. So yeah, so this is really
it's quite a good book, actually. I bought it. You have to go onto the website to buy it, but actually it's a very good book. Good short articles.
Yeah, indeed. So again, that was a quick introduction to 1% Safer. There is a website, loads of information there. We also have a LinkedIn page where we post nuggets, again, from different contributors to elaborate a bit more on what they would have written in the book. And it's a great opportunity for you to, you can buy the book, you can join the movement, and get involved in the community. And as I mentioned, going forward, we're looking to take the funds from the sales of the book to help us professionals and the community through the foundation. So if there's any questions, or if Malcolm, is there anything else you wanted to add?
I'm just coming back on now. No, it was from my perspective, it was a privilege to be part of the setup. And to be honest with you, the idea of a foundation really appealed to me, to actually be able to get some money from the profits of the book and then just use it to do good. I mean, honestly, it's out of this world. And I read the book, and I started to read the book, shall I say, and I just couldn't put it down either. And I'm not just saying that because I contributed to it. I mean, I read it from start to end, and mine appears at the end because it's in alphabetical order. But it's, at the end of the day, it's about the foundation for me. It's about your pledges, being able to say, look, we're going to make a difference. And if we can make a real difference with some money that comes out of the profits from selling the book, giving it back to society, giving it back to people that are vulnerable because of COVID, etc., it's just a fantastic idea. So
yeah, I read the book myself and made so many notes. And one of the things I did personally as well, because a lot of the authors I may not have known, but I went onto their LinkedIn profile and connected with them, and I've been following them and been learning so much more as a result. So it's been insightful for me, and being able to take some of the insights is that it spans so many different topics, from from leadership, mental health, well-being, safety, behavior safety practices, human performance. It's just a wide range. Again, 142 global leaders in this space have contributed to this book.
Great. Thanks for that. So any questions, pop them in the Q&A button. Any questions both from Melissa or Malcolm or Ben, we'll go from there. We'll be sending out the copy of the presentations and the recording for you to listen to. So yeah, so any questions? No, I think we might wrap it up then. So thank you both. Thank you all, Malcolm and Ben from L'Oreal, and Melissa for joining us. It's very interesting what L'Oreal's doing, and a big job there around the world. And the foundation, 1% Foundation, is a great initiative, and I encourage everyone to buy the book if you have a chance. It's certainly a big or borrow. The book is certainly a good book to read, and I've sort of haven't read it all yet, but I've read a lot of it, so it's very interesting. So thank you everyone today, and thank you for joining us. We've got a couple more webinars coming up, one on the 1st of March, one on the 5th of March, one with Vance Walker on marriage perspectives. And so, yeah, keep an eye out for those coming up. So we'll have keep those webinars going. So thank you for the time today, and look forward to talking to you soon. Bye now.
Bye, thanks.
Bye.
Bye, everybody.
Thanks.
Take care. Stay safe. Bye-bye.
Bye.
Thank you, Philip.
Thank you.